So any questions? Usually we have lots, so if anyone's shy about speaking, you can always put them in chat as well.
Exactly. So there are two ways. There are two ways of doing it. So I stopped sharing, so I'm monitoring the chat box as well.
Yeah. Well, can I actually start with something, Thomas?
Mm-hmm.
You started off, one of the first papers you showed was saying about there's no linguistic universals.
Mm-hmm.
Now, this is something sort of a very basic, fundamental thing about language. Is it comes down to sort of Chomsky and universal grammar, and is there anything universal about language? Because people say not, but it seems like it should be.
Well, I mean, you see, for me, it's an empirical question. So I'm not saying that there are no language universals, but we cannot simply assume, looking at one language, and then declare this to be universal. I mean, it happens, throughout the history of humanity in different cultures that, interestingly and not surprisingly, the researchers always found that whatever language they spoke was the universal language. I mean, there's nothing new about English. For a long time in European culture, the idea was that, Latin or Greek were the kind of universal languages. In fact, in the 18th century, you find a lot of French authors claiming that French is the only language that is really faithful to the logic of the mind. So basically what we see now is just a kind of English translation of something that, has been there for centuries, millennia. What I mean is we cannot simply assume, so what I would call the, so to say, egocentric normative universalism, that whatever I know is the norm and everything else is just weird. We need to compare languages, and then out of this comparison, we can find universal findings. And that is true not only about language, that is true about behaviors, that is, by the way, true about genetics, and so on and so on. So for me, the question of universals is not that there are none, but it is something which needs to be empirically, practically searched for and identified on the basis of a broad comparison. So that's what I mean. I think there might very well be universals, but unless I see them based on some, really a thorough comparison, I will be skeptical. I just see someone put a paper about particles and in Thai, so I make a note, so that will be certainly one of my next readings. Thanks. Okay, one moment. How can I go back? Okay. So thank you very much for putting the paper on verbs and particles. So as I say, what I mean is, for me, the question of universality, it should be at the end and not at the beginning of scientific exploration. And that's, I think, it's the problem that we have at the moment, that simply people do something in English and they simply assume that must be universal because English is the language of the mind, and they assume it. It should be at the end, after we looked at a large number of languages with a broad, a broad diversity. So not just many languages from language groups. Okay, and then I see comments from Apurva Puranik. Thanks a lot. Yeah, and the images. Okay, well, thank you very much. I mean, thank you very much for these images. I mean, and I think we definitely need to get in touch because, as I say, what I really liked is, so I think we have to kind of speak about it. What I really like, the idea is to change the tables, to have now Western people responding to non-Western materials. So then we'll see whether it's really universal or not. And then Uttari Maharibold also mentioned that the pool of material for assessment that covers several cultures and languages would be best. And so I think, as I say, I mean, the point of multilingualism is that, if we assume, I think it is related for me to linguistic diversity, because if we assume that languages are basically all the same, that there are no significant differences between languages, then multilingualism becomes irrelevant, because then it's like, you just speak 5 times the same thing. So from this point of view, I would say that the recognition of importance of linguistic diversity is the basis of the recognition of importance of multilingualism. Okay, fantastic. I see now questions from Sonipat and Arjit. Okay.
Hi, thank you. So fascinating. I think my question is that I always think when I make my own data set or picture naming task, for example, I'm always balancing between, like, whether I want to choose something that culturally relevant, or I should choose some picture set that, universal in a sense. But from listening to your talk, it seems like there's no real universal data set, and I should always go to something that culturally relevant. But
Well,
then, what do you think in terms of, do you want to answer that first?
Yes.
Yeah.
No, I find, the idea of universal problematic, because, what you get is in many, you could say, oh yeah, but Western culture is kind of, predominant. What you will get in many countries is that you will get a social divide. So you will get people from, upper middle class, upward mobile, cosmopolitan group, which will then perform well, and a lot of people will be performed very badly. So basically, what you are testing is not cognitive function per se. What you are testing is social class. And I think it's very problematic. And that is the case in many, universal very often means simply just going at the kind of upper echelons of society.
Right, but then there's a trade-off between generalizability and specificity. Like, if you make it so specific to one culture, then that would mean that it will not translate to other culture. Then basically, like, for example, you can divide it. How will you divide Thailand into, like, northern part of Thailand and southern part of Thailand and northeastern part of Thailand, because we're different somehow. And then you can further break down the northern part in Thailand into small pieces. And I understand the point that you're trying to make, but it seems like if we're going into this direction, then we will have to do a lot of.
I understand. I fully understand your point, and the generalizability is important because, for instance, we have more and more drug trials which are using, for instance, patients in different countries. So it is a very, very relevant point. But I think, for instance, simply translating some English text is exactly the wrong way, because you are not generalizable. You are simply declaring that English is normal. In a way, it's just, 200 years ago, I would now, ask you all a couple of questions in French, and if you couldn't answer them, I would say, well, then you are demented. So, yeah, sorry. Anybody who doesn't speak the language of the mind, must be demented. So as I said, there's nothing new in this kind of, Anglo-Saxon thing, although a lot of authors, let's say, have a historical perspective, which starts maybe with their birth. But so the problem is you get completely wrong results. That's why I say, I know it's more difficult, but what we need to do is to go back to which functions we want to test. So let me give an example, not just about language, about the behavior. In all patients, I would say, universally across the world, there are different, behavioral abnormalities are a marker of frontotemporal dementia. But what is societally normal and not normal will be different. So that's why I say what might be normal, what will be abnormal in Britain will be normal in Brazil, Sweden, and so on. There's a fantastic work, for instance, by a colleague of mine in Kolkata, Amitabh Ghosh, who looked, for instance, at utilization behavior being much more common in Asian patients up to Japan than it is in Europe. So from this point of view, we need to go one level back, not translate the test, because then we will get completely wrong results. Look, if you, for instance, want to look whether people can drive, and then, you put someone, I think in Thailand, you drive on the left, don't you?
Yes.
Exactly, like in Britain. And then, so you put, someone, let's say, who is used to drive on the left, and then you get them, let's say, to US, where you drive on the right, and you say, well, this person is obviously demented. He doesn't know what side of the road they should drive. You will get completely wrong results if you translate it. So this generalizability is a pseudo generalizability,
Right,
which basically produces incorrect results. So I think we should try to generalize, but going one step backwards to the level of functions and not the level of the manifestations.
Okay, yeah, to be clear, I'm 100% with you. I just want to, know the level of like the details and how specific we need to go, right? But I'm definitely with you that we shouldn't just use translating from English to Thai and just use it.
No, I realize how difficult it is. I mean, that has been a lot of headache for me over the last 20 years in my clinical work.
Okay, but the second question is a fun one. So what do you think about a programming language?
Well, I mean, we don't know really much. There are not really many studies looking, for instance, whether programming languages really improve cognitive functions or not. I think one of the, or in fact, at least I am not aware of studies that would be kind of looking at it systematically. One of the things that I think is relevant about language is that it has really a lot of different levels. It's not just, I mean, it includes, of course, algorithm, it includes grammatical rules, but it also includes, for instance, a lot of emotional, perceptual, and so on. So you have a lot of social interaction. So from this point of view, from, I think, my perspective, what is closest to languages is music, because music has it all as well. Music has its abstract structure, which can be incredibly, geometrical and so on, but it has also the emotional and the social aspect. So I would say for me, music is the closest equivalent. And indeed, there are studies suggesting that, for instance, active involvement in music has positive effect on cognitive reserve, which doesn't surprise me at all.
Thank you. Music and maybe dance. Thank you.
Yes, of course. I mean, anything connected with that, absolutely. I mean, that I would put dance within music, absolutely. Again, and something that you will find in all cultures, wherever you go.
Arijit,
yes.
Hello, Professor. Thank you for such an interesting session. You just mentioned my question only. I was about to ask that music is the universal language, right? It is a language without words. So in case of dementia, there are a lot of studies happening where people have found to retrain their memories with their childhood musical memories and musical cognition. I saw some of the work of Dr. Oliver Sacks, where there was the patients who have forgot everything but remembered their childhood favorite music and all. So can we use music to retrieve those memories and where people have lost their language ability and they couldn't even understand a single word, or they can't even remember their native languages and all? Can we use music to retrieve their memory as well as to cure that?
Yeah, well, thank you very much for the question. There are, in fact, different aspects of the question. So one is that, it is already recognized since 18th century that patients, for instance, who had difficulty with propositional speech were able to recite, for instance, different, very often religious psalms and so on, so on. There's a famous case by Dolin from Sweden from 18th century. So and that's basically where the musical intonation therapy comes from. The idea that, in fact, it looks incredibly strange. Why is it easier to teach a patient to sing rather than to speak? But in fact, it works. So from this point of view, you're absolutely right. So that is one of the things which is kind of recognize the connection between rhythmic, melodic, and so on language. When it comes to whether language is universal or not, for me, it's an empirical question. And again, I would say probably some of it is, some of it is not. So let's say a lot of this kind of memory going back to childhood and so on will be very, very specific. So what is for me certain kind of music will not be the same for someone else from different culture, and will definitely not be the same, let's say, for my daughter, who is, growing up in a very different musical culture. On the other hand, and I think that is something which, you will probably be more aware of than I am, there are some really interesting studies, particularly in India, about Indian music, where basically, for instance, Indian music was played to people with absolutely no idea. I mean, Westerners with no exposure, and they could still show certain emotional responses that are, so to say, exactly meant they were a special type of rag and so on. So for me, it's an empirical question. As I say, I'm not at all against universals. I'm very much in favor of universals, but we need to look for them and not assume them.
Yeah, I got it. So the thing you said, like different Indian music, specifically ragas, there are some specific ragas for specific timings, and there are some season-specific ragas which can trigger our moods and all. Can it also trigger the patients to retrieve some of the memories associated with their emotional changes and all? Like, for example, I can say, like there is a raga called Yaman that is specifically played in the evening time, and that's it's a raga which is played all over the year. So
Yeah.
it's a very specific raga which is played all over the year, but there are some specific ragas which are played for only 2 months or 1 month. Can we use that kind of things to trigger that specific memory of that time so that it can
Yeah, no, I mean, very, very much so. I mean, I remember, I was lucky to be many times in Chennai during the Margari times, and then listen to classical Carnatic music and so on. And I realized this is exactly December, that will be the time where a lot of this will take place. Absolutely, but then we are looking at the kind of specific elements. So that's why I say we need to distinguish specific and universal. Both of them are important, but both of them are in some way different and need to be distinguished. So it could be, I mean, it could be also, music could be also very, I just tell you kind of anecdote, because I remember once, many years ago, I was supervising projects for Open University in here in England. I mean, in Brighton. I was living in England at that time. And then we had, wanted to induce mood through different music pieces. And we have one participant who came in, started listening to a song and ran out crying. Now, it was a lovely piece of music, and later it transpired, basically, that was the piece of music that she heard was dancing with what was to become her partner. Then they were many years together, and they split just like 1 week before she went to this course. So in a way, so you here have an example that was completely unpredictable, and that would be for me on this kind of the other extreme, where a piece of music most people would say is absolutely wonderful was incredibly painful because of very, very specific association. So we have to look at both. We have to look at this kind of universal things, which I think very important, and then we have to look at very, very specific things which could be different for every person, and if indeed in different situations for the same person.
All right, I got it. Thank you so much.
I just see there are some things on chat. So from your experiences from researchers in different languages, I wonder if you come across any candidate test to detect language impairment that could cut across language and culture, sense in advance. Well, I would say probably picture descriptions are best as long as the pictures are culturally appropriate, because then description of something, universal in all cultures we have food, so, but the food might be different. So I would say there is no, for me, there is not, definitely using passive is not the way forward. Using simple naming is not the way forward. So I think most of the things that we tend to do, I think, is very, very specific. So I would say the more general things you use, the more they can be adjusted. Or if you ask, for instance, patients, how the problem started and so on, then you will get more ecologically valid things. But this is a problem generally in testing, and we have to face it. On the one hand, we want to have tests that are very clear and easy to evaluate with one correct answer and so on. That's why confrontation naming is so popular, but those tests are least ecologically valid. So in a way, it's a trade-off, and we need to find some kind of place in between on one hand, the kind of the ease of administration, evaluation, interpretation, and so on, scoring, and on the other hand, the ecological validity. I don't think we can get easily both at the same time, or at least, if anybody can suggest it, I would be happy to opened my mind and my ears, but I didn't come across it. There are a lot of music in patients can be always quite fascinating, rather limited. Yeah, I mean, as I said, I mean, there is still much more work to be done on music, absolutely. On the therapeutic role of procedural motor memory, which is more resilient, well, again, it depends which disease you have to. Easy or is difficult, or resilient or not, depend on diseases. So let's say in Alzheimer's disease, of course, we assume that most of the subcortical structure, implicit motor memory is more resilient. But if we have patients with Parkinson's disease, it can be exactly the opposite. So from this point of view, I think we should, I know it sounds very radical, but we should really abandon the idea of easy and difficult as objective criteria. I give you a very dramatic example. I remember when I was in Poland working with patients with Wilson's disease, which many of you will be familiar with. And we were working, our testing room were in the basement, and the patient was on the first floor, so 2 levels up on the wall. And unfortunately, the lifts or the lift was out of order, didn't work. So we had to get him down the stairs. I see the patient, and the patient is going like this on the step. He couldn't really, even stand. And he looked like, losing balance every time. And then I was kind of looking, and then he was very clever. He said, "Don't be afraid, I'm fine on stairs," because he realized what I was afraid of. The moment he came to stairs, he was going like this, no problem, because that was a very typical, for basic ganglia patients, if you have the structure, then it's fine. He went down the stairs without any problems. And the moment he then started walking on a plain floor, he started doing this again. So I would say for me, it's kind of the most dramatic example, but you can have it also in cognitive, in everything. What is easy or what is difficult depends on the specific disease. And that's why I think we need to, so procedural memory, motor memory, fantastic. If you have a cortical disease, mainly cortical, then we can use it. If we have a procedural, then sometimes even cortical can compensate. So what is difficult, what can compensate depends on the specific disease. And then to make it even more complex, of course, we can then try to combine it. So for instance, music therapy in Parkinson's disease. So absolutely. So I think that procedural and motor memory is very, very important. But again, it depends on a very, very specific disease, how we can use it. And yeah, great area to work on. Then there was a comment, Apurva, this is great to know. Also, try music therapy whenever possible. Well, I mean, I think music is, fantastic for many reasons. So I would say clearly the sister of language in many respects. By the way, playing music and not listening alone is also a type of metro memory. Yes, absolutely, absolutely. So that's I mean, it's the same for music and for language.
Okay, I think probably we should cut off there because it is getting quite late and some people, I think, need to get back to their families, especially here in Thailand. So thank you very much, Thomas. It's been a fascinating talk, and obviously you can tell by the conversations and the questions we've had that people are sort of enthralled by this today.